Welcome to Beyond The Scalpel. I am one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can
One
learn
second,
more.
sorry, guys, we have to stop. You have to look. You're looking off camera. You have to look directly at the camera. So can I get you looking forward?
Okay.
Because you're looking one way.
Well, maybe we need to move it a little bit toward us because
Yeah,
we're looking directly at it.
Looking to the right of the camera or the left of the camera?
I try looking to the right. See how that looks like?
So like this more?
No, the other way. Because what you're looking is that you're looking at a camera, but it looks like you're facing off screen. It doesn't look like you're looking ahead. If you're looking
Okay,
with the
so
way you are,
we're going to move it and you're going to tell us if we've made it better or worse.
okay, like that. But you want to be facing forward the whole time because it seems like you're looking at something on the screen. But if you just look forward.
So let's look in this corner for a sec, Joe, and see if that's better. So
Yeah,
now is it better or worse?
Yeah, much better, much better.
Okay,
Yep.
so we look at the record button.
Absolutely.
Okay.
Okay. All right. So I'm going to put my thing on mute and here you go.
3, 2, 1. Welcome to Beyond The Scalpel. I'm one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can learn more about us at plasticsandderm.com.
We have a pretty exciting show.
Yes, very important show today.
We are talking about hair loss, everything and anything you want to know about hair loss. We have a great guest today, Amy Gibson, who will introduce very shortly.
Yes, so the statistics are that around 85% of men experience significant hair loss in their life, and nearly half of women, 55%. So this is a topic that we address a lot in practice. And I would say it is the patients with hair loss who look the most distressed when they walk into the office.
Yeah, they're pulling their hair in. It's left in. This is a great topic, and obviously we're going to spend a fair bit of time talking about kind of male pattern baldness. But there's so much more complexity to it. It's not just simply like, hey, you came in with hair loss, we're going to go down one pathway. So take us through, because this is something that you have great expertise in. Take us through when you see someone in hair loss.
Sure.
What are your thoughts?
Sure. And the hair loss topic is huge, and we're going to speak for 15 minutes now. But in a nutshell, when somebody comes in with hair loss, my first job is really to see the cause. Is it nutritional? Is it hormonal? Is it male pattern or female pattern hair loss? Is it autoimmune, which is alopecia areata? So basically, it is normal to lose around 100 hairs a day. Yes.
It's a lot of hair.
It is. And one of the first things I do when someone comes in complaining of hair falling out is I say, I want you to count them.
From your head, you're talking about.
Yes.
Okay.
Where else? Okay. I don't get that. So people come in. Often I'll hear, I wake up in the morning, there's hairs on my pillow, there's hair on my clothing. My hair is suddenly falling out. That is something called the telogen effluvium. Telogen effluvium is when your body responds to some form of stress. It could be a physical stress, such as an illness or a surgery. It could be an emotional stress. It could be a car accident, something that really stressed you out. And 3 months, 3 months later, your hair begins to fall out. And thankfully, it doesn't all fall out, but you are not used to so many hairs falling out, and it is very upsetting. And that is the history of a telogen effluvium. And of course, I do the proper blood test to make sure that's all it is. And if that's what it is, I can really reassure the patient that in 3 months, the process will start reversing. And probably by 6 months, your full head will be back.
Affect men and women equally?
Telogen effluvium?
Yes.
That is a great question. I definitely see more females coming in than males with this complaint.
I guess they notice it more too.
I think so.
Or scary, horrifying.
The hairs are longer, they're on their
Yeah.
clothing.
Yeah.
That's one type of hair loss, but I want to get through this quickly because I know what we really want to talk about is hair transplant. Iron deficiency is another common cause of hair loss, especially amongst people who don't eat meat and are, trying to watch their diet. Also, vitamin D, lack of vitamin D, I see responsible for hair loss. There are many medical reasons. But a reason that we want to discuss today is hormone-based in the sense of male pattern and female pattern hair loss. And this is really genetic. It's your genetic susceptibility to dihydrotestosterone, which is a hormone, an androgen, a sex hormone. Testosterone gets broken down into dihydrotestosterone, and depending on how sensitive your hair follicles are to that hormone will depend on whether it will affect you. Okay, so before we get to transplant, because I know Dr. Elie,
Starting point, but
you're going to talk all about it.
kind of the end.
Okay, there's a lot that we can do for male pattern hair loss or female pattern hair loss. And I truly believe we should do it all because there's no one thing that's perfect. And the more we can do to help, the better. Let's say we start with topicals. Okay, Rogaine is the common name of minoxidil. Minoxidil is a vasodilator. It stretches your blood vessels and it increases oxygen to the hair follicle. And minoxidil works. It does. Topical minoxidil, Rogaine, comes in the form of a liquid or a foam, and you can basically get it anywhere, right? You can get minoxidil in Costco, in Target, in CVS, in our office, and it helps when wherever you put it, you do grow hair. Right?
Yeah.
Okay, the problem is that when you stop using it, whatever hairs grew from putting it on will fall out.
You won't end up worse off than your starting point, but
Yes.
you'll end up where you were meant to be if you weren't using it.
That is the key point. Everyone is afraid to use it. Many people are because they say, oh, won't it cause my hair to fall out when I stop using it? No, it's not going to cause other hairs to fall out. It's just that the benefits of using it go away. And I truly believe it's fine to use it every day. I usually put it on after the shower with a wet scalp, and you put it just in the areas where you need it. For women, it's often the temples and the middle part. For men, it's more diffuse around the scalp. Minoxidil is great. It works. You have to be careful not to get it on your face if you don't want to grow hair on your face or any other part of your skin, because you will grow hair where it touches.
Full disclosure, I use it, which is not really an earth-shattering statement, but I bring this up because, I apply it and then I usually would apply it. I put it in my left hand and apply it with my left hand, and then I wash my hands off. And there was a period of time where I wasn't washing my hands off probably as well as I should from it, and I noticed that I was getting more hair growth on the back of my knuckles.
That's interesting.
And so I started washing my hair more, and I went back to base.
Right. A common complaint is if it drips onto the face and people don't clean it. Or you put it on right before bed and you lay on your pillow and then you move your head and your cheek touches your pillow. So yeah, you do have to be careful. But most people get the hang of it. But sometimes topical is not sufficient and you need a little bit more. So then we get into oral medications for men. Alopecia, finasteride, has been around for a long time, very common, works well. There is the side effect of sexual dysfunction if too high a dose is used for certain people, but it is reversible. You go down on the dose or you stop taking it and everything goes back to normal functioning.
Kind of like with the Rogaine, there's like this fear of it, and like understandably people don't want erectile dysfunction, but it's like you said, it's reversible. So that it's rare to begin with, but when it does happen, it's not like it's something that has any persistence as long as you kind of adjust or stop.
Correct.
And so there's really no downside to it.
If someone has a family history of prostate cancer or personal history, don't use it, not because it causes prostate cancer, but because you will find that prostate cancer at a later stage, which is more dangerous because it does shrink the prostate. So it's harder to identify prostate cancer. Okay, there is also injectables. PRP, platelet-rich plasma, is excellent. I love it. We take a regular blood test, we spin down your blood, we isolate the clear part of the blood, which is packed with platelets, and platelets have growth factors. We inject it around your scalp, helps the hair grow, it increases the volume of your hair, it increases the density of your hair. It works. Nothing is perfect, but it does work. We usually do one treatment a month for 4 months, and then we wait three months and do another. There's also adding exosomes, although that's sort of a conversation I don't want to have right now because there's not really FDA approval for that at the moment.
Yeah, that's something that's probably in the pipeline more and will
Yes.
probably be mainstream involved, but
We're gonna hold off on discussing that. I also failed to mention oral minoxidil by mouth, which has become very popular lately in men and women, and it does work. works beautifully. One of the side effects of minoxidil, specifically in women, is that they are seeing increased hair growth in places where we don't want hair growth. So, but if we lower the dose, then it controls it. And many women are very happy to have extra hair on their scalp and have to do a little extra laser hair removal on the cheeks or plucking with tweezers, if that's what it means. Okay, should we get into hair transplant?
One last thing, low
Yes.
energy light.
Low, yes,
laser
tell us
combs,
about that.
Laser combs, laser hats. There are a million of them out there. You can find them in all forms, and there's some information that shows that can also contribute. And getting back to your point, like everything that we've spoken about prior to talking about hair transplant are things that help. They're not like overnight you suddenly look great. They kind of augment and help, but they're not spectacular, dramatic. Oh my goodness, I went from having real hair deficiency to, oh my goodness, I've got more hair than Tom Brady.
So the low level light that you were discussing is red light or near infrared light, and it does increase oxygen as well to the hair follicle, so it increases hair growth. Amongst everything, I don't know that that's my number one.
Well, the real problem is that just like anything else, you have to continue to use these things to get value with it. And it's really easy to put a topical product or take a pill or go in, a couple of times a year to get some injections. But to put on a weird looking baseball cap, every night for the rest of your life, is something that most people don't sign on to.
Correct. Although if you think about it, you probably could incorporate it into your daily routine at some point. You watch some TV or you read a book, read the paper, you put your laser cap on.
Softball league, stuff like that.
For what it's worth. Okay, so when is it time for hair transplant?
When is it not time for it? No. The hair transplant is great for the right person. So if someone comes in and for male pattern baldness, they've completely lost their hair and they have no hair, it's probably not the ideal candidate, because the concept of hair transplant is quite interesting from a kind of intellectual standpoint, because every hair on our head is pre-programmed to survive a certain amount of time. And obviously we can adjust that and shift that curve with these products and different things that we've spoken about. But for the most part, every hair has a certain survival time. And that is based on its location of origin, no matter where you move that hair. So if you look at someone that we would describe as bald, they generally will have that horseshoe distribution along the back and sides, even when they're bald. If you take a hair from there and were to move it somewhere, it will survive in that new location pretty much like it's been doing back there. On the flip side, if you wouldn't take a hair from the front of someone's head, you generally move it somewhere else, because there's a high likelihood that at some point that's going to fall out. Right.
Just to further knock that point home, the hair follicle keeps the characteristics of where it came from.
Correct. Okay. Yes. So if and that hair that you take from those donor areas doesn't grow back, so you need to leave enough density so that back and sides look great. Now, with all that being said, hair transplant is a procedure. It's done under local. You don't need to go to sleep for it. It's probably about 5 minutes of discomfort the entire day. It does take a bit of time, so you have a lot of downtime. You can nap part of it. You can check your emails. You can read. You can watch a movie. Do all kinds of things like that. But basically, the idea is I'm taking individual hairs from the back of your head. I'm using a needle to extract it, so there will be no scar there whatsoever by the time, even a week and a half later. And you take those hairs and move them to a new area.
Right. Can I stop you?
Jump in.
Okay. We are just taking it for granted that everyone who's listening to this assumes that hair transplant is taking one hair, right? One hair follicle. But that is not the way every doctor does it.
That is true. That's true.
Some people do the strip method,
correct,
which is when you actually cut out a strip of scalp that has a bunch of hairs and hair follicles, and you use that.
And you chop it up into little pieces and you implant that.
Right.
And I would say that when that was, and there are still practitioners that use it today, I really don't do that procedure. And the reason why is that if you wear your hair very short, or you get out of the shower wrong, or out of the pool, or any number of things, that scar can be visible.
Yes.
And that scar being visible is a telltale sign of having had a hair transplant.
It is not a pretty scar.
Correct. So I never, I started doing a lot of hair transplant when I started doing follicular unit extraction.
Right.
Individual
FUE is
the
initials that everyone knows.
And there are two benefits to your point. One is it's scarless in terms of the back, the donor area. The other benefit is that the problem with the strip method potentially is if your practitioner doesn't take the time to separate each of those hairs, They're essentially transplanting a fair number of grafts together. And to the naked eye, they don't look big. But when you put in 3 or 4 hairs together, or 5 or 6, even more,
Yeah.
you look like those Barbie doll kind of things.
It looks very
It's
funny.
horrible.
You have like this
Hair
crowd of
plugs.
hair.
They look
Hair
like-
plugs. Thank
They
you.
look like plugs.
Yes. So
That's what
the right way to do it, which is the way, of course, Dr. Elie does it, is the FUE. Tell us more about
Yeah,
that.
so you take out those individual hairs, you separate them out, because I'm oversimplifying a little bit, but the hairs, for example, on the lower part of my back of my head is very different than the ones higher up, and you want to kind of adjust them because there is kind of an art to it, not just the straight science of it.
Right.
And then you place those grafts in. You place them, I'd say there's a week to a week and a half of what I'll call social downtime. So you're not in pain. If you have a job where you can work remotely or from home or any number of things like that, it's easy, it's seamless.
Oh, yeah.
But in terms of like, when can you go back out in public? No one knows you did anything. About 7 to 10 days. Those hairs don't grow in right away.
Okay, wait a minute. The 7 to 10 days is for men.
For men, great point.
Yes.
And I would say that probably about a quarter of my patients are women. Obviously, people think about hair loss, they think men,
Right.
because one, it's very clear when they walk into a room, they have hair loss unless they have a terrible toupee on or something like that. But for the most part, you know that they've lost their hair. Women can lose hair and lose a significant amount of hair, and it can be horribly distressing and an unbelievable burden for them.
Right.
Yet they can hide it a lot better with products that kind of camouflage it or just how they wear their hair.
Right.
But the benefits that women have is there's basically no downtime from hair transplant. Because if they have their hair, unless they're wearing their hair very, very short,
Right.
they can hide it very easily. And there really is that lack
Right.
of social downtime.
Yes.
So that's a huge point.
And the reason for the downtime that we are discussing is that the area where we take the hairs from has to be shaved.
Right. So I buzz cut it, and you see little dots where those little scabs are. Now, in guys, if they don't have long hair, you're going to see those little scabs till they fall out. And women, if they have long hair, I don't need to shave the entire back of their hair.
Right.
I can take out little strips here and there so that they wear their hair down and no one knows they did anything. And they can
Right.
hide that area until the rest of the hair start growing back in.
And I just want to add in one more little pearl. Women do lasers on my mind. Women do hair transplant, not just for female pattern hair loss, but also to hide scars.
Okay.
Right? Sometimes
Yeah.
some doctors leave scars from facelifts or various procedures, and you can put some hairs in that area to hide them.
Yeah, works brilliantly. Once we do a hair transplant, again, 7 to 10 days of downtime, and then there's kind of a waiting pattern, because when you move these hairs, they go into like this dormant kind of sleepy phase, and it can take anywhere from like 6 months to a year for them to kind of reactivate. I'd say that somewhere between a year and a year and a half, you get kind of the full effects of it. Now, on the one hand, you say, gee, that's really lousy. If I did a procedure today, I'd like to see the results tomorrow. And that is true. But if you did a hair transplant today and you walked in tomorrow and you had a full head of hair, everyone would know you did something. And so by them growing in slowly, people definitely pick up on the fact that you look better. They have a hard time picking up on why, which is great. You know, they say you look better. Did you just, were you on vacation? Did you lose weight? Is that a new dress?
Now,
That's a lovely dress. Is that a new dress?
no, but thank you. So even if you do a hair transplant, one of the questions I often get is, then do you still need to use minoxidil? Do you still need to take hair vitamins, which I forgot to discuss? And the answer is, of course, yes, because the new hairs that Dr. Elie has put in, those are there to stay, but that's not going to prevent other hairs from falling out. Hairs that, were there when you were 35, but when you're 40, they are no longer there.
Yeah.
So,
That's a great point. Yes, absolutely. One is not, they're both things that are of benefit to people.
right. And it is common for men or women to do more than one hair transplant, because as the years go by, the original hair transplant still looks great, but now you've lost more hair and you need to put in more. And the nice benefit to the way you do it is that there's plenty of hair left normally to transplant again.
Correct.
Right?
And so the problem, the other problem with this strip method
Correct.
is that if you try to do multiple strip methods, at some point, we don't have a lot of extra skin back here.
Right.
The scars become really, really unsightly, and you run out of space, and it's painful, and there are all kinds of negatives to it.
Yeah.
I treated someone just last week with FUE because they had multiple strip methods, and I was able to kind of hide it with the way I did it, but
Right.
otherwise they would look ridiculously bad
Yes.
in their donor area just because of that. So
Yeah.
it definitely gives an opportunity to people that wouldn't have otherwise.
Right. I think we really covered hair transplant pretty well.
We did.
Excellent.
You kept me on target as I
Okay.
tried to overtalk this stuff.
No, you did a great job. So a woman has a hair transplant, tell me, is there a difference in your technique from a man?
So it's not so much as a different technique, but when I analyze someone before the procedure, getting back to your point of like, can people do more than one hair transplant? The answer is, of course, yes. But my goal really is a fewfold. One is to address what they need today or what they're coming in for today. But I also want to I want to almost anticipate where they may have further hair loss. And so, number one, if they do need another procedure, we can push it off further, or maybe they don't need another procedure. But in addition, I don't want them to get into a position where it starts looking unusual or ridiculous. So I'll give you an example. Let's say someone has hair loss in their temple area, and I sense that it's kind of receding that direction. So the last thing you want to do is put a lot of hair into that area,
Right.
which looks really great 6 months, a year later, but then they come back 2 years later and they have the skip area. They have the hair, they have missing area, they have hair. And yeah, it's fixable. You can do hair transplant in between and do it.
Right.
But then you're kind of doing another procedure in close time period, which is not, the
Yes.
ideal if given the choice.
So
So you're feathering back there.
exactly. A lot of patients come in and they say, I want my scalp line to be brought out.
Right.
And that's not the goal. You want to,
Right.
Start further back because you are going to continue to lose hairs.
Yes. And even people who will describe as having great hair does not have the same hair pattern at 50 that they had at 30. And so if they come in at 45 and they say, I want that 30-year-old hairline, it's one of those things where even if it's a unbelievably natural hair transplant, if they have the hairline of a 30-year-old at 50, it won't look natural.
Not
There'll
at
be a
all.
disconnect because their other features are natural looking. And so people will pick up on something's wrong. They won't pick up that the hair transplant's wrong, but they'll
Right.
just say there's something off. And so the whole idea is that you don't want to set someone up in the position where they will look ridiculous at any point. It's very doable. It's just a
Right.
matter of me, do my
Yes.
planning beforehand.
So like everything, there's a science and an art.
Correct.
Okay. So should we introduce our guest?
We should introduce our guest. I think that's a brilliant idea.
Excellent.
We'd like to welcome to our show Amy Gibson, an alopecia expert, advocate.
Advocate. Hello, Amy.
Hi, so nice to have you with me today. I appreciate it.
Thank you. So you founded createdhair.com. Can you tell us about that?
Right, so createdhair.com is the online, pardon me, Created Hair Design in Beverly Hills is our private studio. We've been open for 25 years. And we are a little different than wig stores because we're more specialists on actual hair loss. So it's not only finding those things that are going to make you feel comfortable again as a wig or as a hairpiece. It's not really only about that. It's actually about taking somebody in a very traumatic state. I have no hair. I know what it's like to lose all your hair. It's incredibly traumatic. Women identify with their sexuality and their sensuality. And when their hair goes, it's like, right? They're like a blank canvas is how they feel.
Sure.
Right. And so what we try to do is a little bit more. We're not only a wig store, although as you can see, there's tons of wigs.
Yes.
It's more about finding the fit first. What is your life like? Are you dating? Then great. Then you know what? You should get my book so you know all the things you need to do for intimacy. If you're going to be going into this and you're going through chemo, and that's our specialty is cancer, then I'll walk you through the process, meaning when is the right time to take off your hair? And actually, if it's good hair, let's save it because we could use it for something. And it may take too long to make a wig right now because you're going through chemo, but I can make several other things, bangs, toppers, ponytails, whatever you may need, or another wig for later. But where's the sensitivity? Let me know what you're taking. Let's talk about the follicle sensitivity, as you're well aware of. That usually is about 3 or 4 days. What do you do for that? And what do you sleep in? You know, how do I tell my lover? How do I tell my kid? How do I tell my employer? And do you need to? Right? I mean, all of these things are really important. This is a journey. This is a way of life for somebody. This isn't just, hi, I'm going to go buy a wig. This is you know what? I'm like changing my life right now and taking on this journey. And I need to really make it innate. So I'm not concentrating on this thing in my head 24 hours or 8 hours when I'm wearing it. And I'm also not acting really weird with people. That's a big thing women do. Oh, how are you? I'm okay.
Right.
Yeah, and then people are
Everyone
like,
plays with
"What?"
their hair, even if you don't have a wig.
I'm serious, you know? And what we try to do is similar to what you do, right? So you're creating transformation, and then that person has to learn to live with this new phase. And maybe it's going to drop a little, and you have to know that it's going to drop a little, and then you're going to be refreshed, or maybe we're going to put fat, whatever it may be. But that's a different journey. That's
Right.
going to look different than when they first met with you.
Right.
And there's a journey that someone goes through. Are they worthy? does that person feel worthy? Because if they don't, no matter what you do and no matter what I put on you, it's never going to work.
Mhm.
So you have to get in touch with, like, how okay are you with this right now? And if you're
Right.
not, let's get you a little better, knowing that there are possibilities, and get you out of feeling like a victim and feeling more into feeling victorious and taking over this thing that you feel has completely stifled your life. And with you, it's everything with wrinkles and body and everything else that you're amazing at doing. I mean, Steve told me, and then I looked up your website. I was like, oh my God, I wish in New York I want like half of it. But the
Well,
thing
yes, I mean, this sounds and looks amazing. I have a very, very ignorant question. If somebody has, I know of a lot of people who wear wigs that have clips.
right.
Okay. If you have no hair, how is that wig staying on?
You tape it on, number
You tape
one.
it on.
Or I have the Wig Secure Wig Band. That is a band that you wear around your head underneath. It's the only one that's actually medically endorsed by the largest cancer surgeon in the country. And the inside has a silicone strip. You wear that against your head. The other side is felt. And when you put the wig on, it doesn't move at all. So I usually have people use both because I want to have alternatives. Now, if somebody's wearing clips, I have a real problem with clips. I've had many people where I've said, I'm not the girl for you. You need to go elsewhere. Because if I feel when I'm testing your hair that your hair is weak,
Yes.
you're going to either indemnify me or you're going to go elsewhere because it's not worth the sale to me. Okay. So for me, I really test somebody to say, this is the most vulnerable part, as you know, right?
Yeah.
And I'm going to put clips in.
Right.
And
That's always the part that I'm uncomfortable with. Yes.
Well, the other part I have a problem with is people go, it's tape-ins. It doesn't take anything out. You are so full of it, okay? If you are down, I don't care if you're using a glue remove, you're going to see little hairs each time. And we all know that 50 to 100 hairs are normal to lose each day. However, we don't talk about breakage.
Right. That's true.
That when you're clipping in, all of a sudden you got the flyaways here and there, and you go, wait a minute, I lost my volume. No, it broke off. You didn't lose it. You're damaging it.
Right. So if someone has some hairs still on their scalp, just not enough.
You can do a topper, but the way we do it is a little bit differently. So I use plastic clips, not metal clips. Plastic clips, is only one place who makes them out of Thailand, and they're incredible. And although they have to catch on, they don't rip. They do not rip like the metal clips. And plus, I try to not get near the vulnerable place. As I said earlier, I do burn victims, and you know that a lot of their head is numb. But there are certain parts that aren't, and you have to really test it. So the same thing with somebody who's going through chemo or alopecia. There's some sensitivity, especially with scarring alopecia. So I'll maybe make a bigger piece. Instead of doing something smaller, I'll kind of bring it down so I can clip here and here. And so you want to not get near the vulnerable areas. You know, I'm hair health first. I can do anything with style and color. I have the best girls in the industry, Emmy winning. My girls are amazing. I'm not a stylist, I'm a designer. But I still have to know where your sensitivity is, right? And what your lifestyle is. And do you want to look 10 years younger? Great. Well, that doesn't mean by putting 40% more hair on. Anything over 20%, literally, anything over 20% more hair, you're going to be asking for my card. But under that, I'll say to you, I don't know, did you go to the Levines? I mean, I'm going to say, like, what's up? You look amazing. But I won't know if you're wearing a wig. And that's the big mistake women make, is they overcompensate. Oh my God, I've lost so much hair. But then the problem is when I put something on that's even 20%, they've been walking around with thinner hair for so long that any amount of hair is going to seem too much. And it takes time for the right and left hemisphere to kind of come together and look at themselves. You know this. You deal with symmetry all day long. So do I. And you have to kind of look and go, wait a minute. It's going to take a few days. And then in a few days, you'll come back next week. And if we really need to take a little bit more out, we'll take. But I need you to get used to a little bit more hair right now. We don't have to have a lot, just a little bit more. So I take them step by step. And created hair was really everything I've done, whether it's the scalp cushion, which is my new liner to avoid those itchies and the pricklies from wigs, or the wig band or the rescue bag or my book, Sex, Wigs, and Whispers. Any of this stuff comes out of my own frustration. There was no wig band on the market that didn't slide. I had to figure it out. There was nothing for me to stop the itchies. I would use paper, I would use tissue, I would use lace, nothing. And it took me 6 years to create scalp cushion that has the natural curve, and you wear it just underneath. It's a little liner, and you just wear it underneath your wigs, and it stops all the itchies. All this stuff is just from my frustration. The first women's water wig that I came out with in '08 that kind of put me on the map. That was because I don't like myself in bathing caps.
Wait, tell us about that. What is the water wig?
Oh, the water wig I created in '08, and this is called the first women's swim wig with cyber hair, and you can literally swim with it, and water will go right through it. If you're thinner hair that doesn't look so great when it's wet, or you have no hair, pop this thing on, and you can swim normally with either taper clips, and that will not come off, and it looks exactly like European hair. And that took me 5 years to create that. So all this stuff just comes out of my own frustrations, which I'm sure some of the stuff that you create, I mean, look how gorgeous your skin is. It's like sick how gorgeous your skin is. But I'm sure there was a time that something happened or someone next to you, or you know what? I got to look at that. I mean, it reminds me of a line that's out called Les Mieux. I don't know if you carry it, but it's simply for people going through radiation and chemo. With 3 oncologists who created it because there was nothing around for their parents when they were going through treatment.
Right.
So I always gravitate to stuff like that, you know, and I have 1,000 different things that I could come out with. We just try to take step by step.
Now, do you go to patients' homes or to the hospital, or do they?
No, we don't go to the
come
hospital
you?
anymore. I will do home visits if somebody is truly bedridden, but most of the time we're so centrally located and we're very, very private. Only one person at a time comes in. You know, I'd rather them come here because the downstairs is the showroom and the upstairs we do the molds, the custom work, the styling. So I really want to be able to fit that piece to somebody. So literally they're not even knowing they're wearing anything, right?
And you walk us through that. Exactly what does that mean to make a mold?
So there's a couple of ways of doing a mold. You can do plaster of Paris, but I use the old way with Scotch tape and saran wrap. And you literally will put saran wrap all the way around. You've never done this with any of your stuff when you're doing symmetry or anything? Or do you guys only do skin? You only do body?
We do skin, we do body, but we've never made a hair mold. So a wig mold. So talk me through it.
So we put a piece of saran wrap all the way around to about here.
Uh-huh.
And I draw on it. I draw your hairline, right? I draw your hairline. And then I put clear shipping tape. And I keep on going all the way around. And then you lift it, and there's your head. And then I cut so it fits around the ear where I've marked. And then we put it back on. And it's packed in a really strong box with tissue paper and all this stuff. And that's what goes to the factory to make your piece. But we also have a phenomenal alterationist. So when somebody can't wait, if they're going through chemo, then we'll just customize and take in and highlight and do whatever we got to do to make sure the piece is right. So not everybody needs custom. We have a lot already made, a lot of pieces ready to go.
Okay. How often does a wig need to be cleaned?
Such a common question. I always say to somebody, you'll know. It's like, you know, if it has that fragrance or if it's not moving, then you know that it needs a wash, right?
Right. What's the average?
I'm here who's here to get her piece washed because it's been a while. It's been a month or 2, right? Has it been about 2 months? How long?
3 months.
3 months? Okay, so she waited a little bit. Most of the time about once a month.
Uh-huh.
If you're wearing it every day, all day.
Okay.
Yeah.
So people will come to you, they wait while you wash and style it?
They'll drop it off the night before. With my client here, it's a little different. She has an event to go to after this. But normally they'll drop it off the day before and they get it the next day. But also Created Hair by Amy Gibson is my YouTube station. And I did over 100 tutorials. And it literally shows you how to do everything on this wig journey. So you absolutely do not feel lost at all.
Okay, Amy, you are truly a wealth of information.
Yes.
Thank you.
You're doing some
I want
amazing
you to know
work.
I'm calling you about something when I hang up, just so you know. Okay?
Anytime. We are happy to contribute.
Thank you.
Well, we really appreciate you giving us all this information and time. And thank you for the wonderful work that you do. Created
you're
Hair
You're
by
so
Amy
sweet.
Gibson.
Thank you.
Thank you so much for joining us.
Guys. Good luck with your show. I'm going to post it. Will that be okay when you tell me when it's on?
Awesome.
Of course.
Okay, wonderful. I bless you. Thank you, sweetheart.
Take care. You too.
Take care. Bye-bye.
So that was great. This concludes another episode of Beyond the Scalpel.
Thanks, and we'll see you here next time.